When my husband experienced chest pain, I knew he had to go to the ER at Fairview Park Hospital because it had an accredited chest pain center. Chest pain isn't like a broken arm or a high fever. They treat chest pain like the serious condition it is, and they treat it fast. And it was a good thing we knew the difference because my husband was in cardiac arrest.
Oh, I was fine.
Now he is.
Treat chest pain like chest pain. Choose the ER at Fairview Park Hospital.
Stay with us for the next 30 minutes as you meet our doctors like never before. A program that will allow you, our viewers, to make more informed decisions when it comes to your health care.
Hi, everyone, and welcome. We are here at the beautiful Ice House at the Doctor's Welcome Reception, and we have some wonderful physicians here that have been coming from all over the place, and we definitely want to welcome them here to the neighborhood. We've got Dr. Rick Oster here, who's the medical director hospitalist.
Yes.
And we definitely want to hear all about you.
Okay.
And tell us about what's coming in here.
Okay.
And introduce everyone for us.
Okay. I'm a board-certified internist and have been doing hospital medicine, inpatient medicine, for about the last 7 years. We're extraordinarily fortunate right now. We've had an influx of inpatient specialists to staff the program here over the last 2 months. Besides the core group, which has been here and worked extraordinarily hard for some years, we have Dr. Charles McCormick, Dr. Paul Matthew, Dr. Nicola Rebel, Dr. Badri. These are all full-time people that will be dedicated to the program, not part-time. They'll be here. And each has their own nuance of expertise. We have people that did extra training in geriatrics, palliative care. One of the hospitals that's been here long-term is infectious disease. We have an incredibly eclectic mix of physicians that astounds me for an area this size. I'm impressed, I'm excited, and the future looks good for us.
And, that's what I wanted to say. I mean, an area of this size, to have that many come in, that's quite impressive, and that's something to say about the care that we're receiving here.
Yeah, I think it speaks to the care we receive. I think what it also speaks to, though, is everyone that came here really felt a sense of family, which you sometimes lose in a much, much larger place.
Right.
And so each of the physicians that came here, interviewed, and looked at this place were drawn here because of what was here.
Right.
And I think that speaks very highly for the institution.
And now what drew you here? Because you've been here for how long?
I just came here about 3 months ago. And actually what drew me here was Don Avery, the CEO. He is an impressive, honest, and dynamic guy. And as CEOs go, I've never quite met anyone like him.
Right.
And he was the deciding factor for me coming here.
Oh, he's pretty amazing.
Yeah.
I mean, we put him way up here.
He's up there. He's up there.
And where did you come in from?
Americus, Georgia.
Americas.
Yeah.
Wonderful. I'm very familiar with Americas.
Okay.
And so you bring your family here with you, or you?
Yeah, traveling right now. Just put a son in college, so we'll see where it goes from there.
How cool is that?
That's pretty cool. It's pretty cool.
Well, we're certainly excited about everything that the program has to offer, and having you here, your family,
thank you.
and also these new physicians that are here.
Well, thank you.
Welcome to the neighborhood.
Thank you so much.
Dr. Rick Oster, everyone. We are here with Dr. Charles McCormick, a.k.a. Charlie, one of the hospitalists here. Welcome to the neighborhood,
Thank you
sir.
so much.
Now, tell us a little bit about yourself as we introduce you.
Sure. Well, I'm very excited to be here. I come from upstate New York originally, by way of Boston, Washington, most recently Durham, North Carolina, and now Dublin.
Making your way down.
Making my way down. I've come to see the light, and I got to be here. I'm very excited to be here. I grew up on a dairy farm outside of a town of 800 people, so for me, Dublin is the big city.
No one would believe that when you say upstate New York. They wouldn't believe dairy farm.
Oh, upstate, I'm talking 8 hours from New York City, cows and chickens, way out there. So for me, this is, like I said, the big city. Very fast, very excited to be here. Just wonderful to be here.
Wonderful.
I'm coming to work at Fairview Park Hospital here as a hospitalist. Coming down from Duke, where I did my training and stayed on faculty for a year.
How cool is that?
And it's very wonderful. Just very exciting.
My son wants to go to Duke. He's in the 10th grade now. Entered the, he's part of the Duke TIP program.
Yeah.
And he just wants to go to Duke University.
For some people, it's just in their blood, and I sure hope he gets there. Great place to live, great place to go to school, and all of that. Maybe he'll come down here too.
Absolutely. Now, tell us a little bit about your area of expertise.
Absolutely, sure. So I trained in internal medicine. So this is sort of the umbrella field for all the medical specialties, your nephrology and pulmonology and cardiology, all of that.
Right.
And I also did a residency in psychiatry. So I do the two. So and it's been a really wonderful thing to do because every person who's afflicted with a medical illness, there's always a psychiatric component. It always affects your personal life and the way that you view the world. So to be able to kind of bring that perspective and talk to people on both levels, it's been a wonderful way to get into medicine. And so I've been really excited to bring that to Fairview Park and try to have that perspective on things too.
That's so cool that you took that in psychology because it's so needed. There's so many doctors sometimes that don't quite have that bedside manner that they, could use.
That's putting it gently.
Putting it mildly. And so to have you with that background, we are so pleased to have you here.
I'm very glad to be here.
And we're excited to see what you have to offer here in Lawrence County.
Thank you.
Welcome to the neighborhood.
Thank you so much.
Dr. McCormick, everyone. We are definitely keeping it in the family here. We've got Dr. John Shivdat and Dr. Rosita Shivdat. And we're so glad to have both of you here. Welcome.
Thank you.
We'll start off with you, sir. You tell us a little bit about yourself and tell us about what you do here.
My name is John Shivdat, and I'm the medical director at the Fairview Park Hospital for the emergency room, and I'll be starting October 1.
Now, did you just get credentials?
Yes, ma'am. Yesterday.
Awesome. And you are definitely a husband and wife duo, aren't you?
Yes.
We'll come to you, and you tell us about the family and tell us about what you do.
Well, we have two sons, 14 and 10 years old. They both go to Stratford, and they love it. And I try to be home as much as I can.
And you're a physician are you out of Warner Robins or Macon?
Warner Robins.
Warner Robins. So if you would tell us what it is what your specialty is.
I'm a neurologist, trained in epilepsy at Emory University Hospital.
Wonderful.
And I have my clinic, Advanced Neurology Specialist in Warner Robins. I do a lot of epilepsy in the hospital as well. I started the EEG monitoring unit at Houston Medical Center and continuous ICU EEG monitoring as well. It's keeping me busy.
Definitely, and that being a mother keeps you busy as well, trying to keep that balance. How do you keep that balance?
Oh, I have good kids.
Good kids. That's the key, is having good kids. Very good. Now, we're definitely glad and excited to have you here with us. Now, and you've got some exciting things going on in the ER now.
Yes.
Tell us about that.
We just broke ground to a new expansion, trying to get up and do a pediatric emergency room section. In addition, we'll be doing ultrasonographic studies in the ED. And we're bringing a team of fully qualified ER physicians, residency trained, along with some mid-level providers who are exceptionally trained, well experienced. And we hope to serve the community as best as we can.
We're excited about that, and we're excited about what you're bringing to the community.
Great.
All right. This is the Dr. Shivdat, and we're so welcoming to have you here. Thank you all so much.
Thank you.
And we are here with the Hollander family. We've got Dr. Sandra Hollander and her husband, Mal Hollander. They have been here every bit of one semester. 3 months?
3 months.
Yeah. Welcome.
Thank you.
Now tell us a little bit about yourself and tell us what you're going to be doing here, what you're doing here
I'm
in
a
Dublin.
hematologist-oncologist. I had a practice up in New Jersey for more than 20 years.
You're a Jersey girl.
Yeah, and the financial pressures and the political pressures just got to be a bit much. So I decided to go to a better lifestyle. So I came down here.
Right.
I wanted to go where care was needed in the underserved rural area because it's too concentrated and super saturated up in the Northeast.
Absolutely.
So I wanted to go where my skills are needed.
Absolutely. And the physicians that you're working with are?
And I'm working with Dr. Kazi.
Oh, great
He's
physician.
a real pleasure to work with.
Absolutely.
And his staff, excellent.
Aren't they wonderful?
Yeah. Patients feel very at home.
Absolutely. And Dr. Kazi was my sister's physician, and he's
how
great physician. Wonderful. All right, Mal, tell us a little bit about yourself.
Well, I have a business producing a product called the Neuro Voyagers. They're a chair that uses sound, light, and vibration. Take your mind and your body into deep relaxation and feeling well, and dealing a lot with the sports world. One of my partners is Marvin Frazier, who's a former Denver Bronco.
Fantastic.
And we're actually doing a golf tournament that we're going to be showing this at this coming week.
Wonderful, wonderful. You both are definitely busy.
Yes.
How was it for you transitioning to come down south, so to speak?
It's been a delight. It's phenomenal down here. The lifestyle is fantastic. People are friendly. It's just a great community to live in.
Absolutely. And you're talking about coming down here to work in a more rural area where there's certainly a need. You know, we feel very fortunate to have so many physicians and the specialties that you have.
This is a great place. It's very civilized, though, at the same time as being very relaxed and laid back.
Absolutely.
The doctors, the quality of care here is superb.
Absolutely. So, I mean, the people out there, you have some wonderful physicians, and the quality of care, it absolutely is excellent. Yeah. And so we're pleased to have both of you here.
Thank you.
And again, welcome to the neighborhood.
Thank you.
Thank you very much.
Thank you.
Thank you.
The Hollanders, everyone.
From strains and breaks to tears and pulls, you can find quality orthopedic care right here in Dublin. Fairview Medical Group Orthopedics treats a wide range of issues. Our staff will give you the individualized attention you need. Dr. Heath Ridgeter focuses on the treatment of sports-related injuries and pediatric orthopedics. And Dr. Dustin Gay specializes in the interior approach to hip replacement surgery. Call 478-274-8886 for more information or to schedule an appointment.
You know, it's been so exciting to be here today. We're definitely making this a family affair. We've got the Thomsen family here. We want to welcome you, Dr. Julia Thomsen. Welcome. And you've got your husband and your daughter here.
Yes, my husband and my daughter.
We're going to first start with you to let you introduce yourself to everyone out there.
And I'm Julia Thomsen. I'm one of the pediatricians who recently joined Dr. Shaw's Pediatric here in Dublin. And originally I'm from Russia. It's far away. It is in Volgograd, which is the Stalingrad, probably most people know by this name. And my husband brought me 10 years ago and brought me actually to Cochrane, where we're still living.
The big city.
Exactly right. Where we're still living now. And I'm doing Dr. Shaw's pediatric practice for the last couple months and really enjoy it.
How has that transition been for you?
Finished residency program a couple months ago. It's definitely a little bit different, but I really enjoy what I'm doing.
You're now putting everything that you know and have learned and have absorbed.
Exactly right. I have been practicing in Russia before I left, and I was the general pediatrician before. And this was some changes and definitely adaptation between the different cultural stuff and some medical stuff. But I enjoy residency program at Mercer University School of Medicine, and now I'm here in Dublin.
Well, we're so pleased to have you
Thank
here.
you.
So pleased. And this gentleman to your left, hello, sir.
Yes. This is my wife.
He's my biggest supporter.
I bet he is.
I don't know how I stole her, but I stole her away from Russia.
She's fabulous. Tell us a little bit about yourself, if you don't mind.
I'm a mechanical engineer. I work on the Robbins Air Force Base. Been there for about 30 years.
You're a staple down there then. You're like one of the big men on campus.
A lot of people know me. I've kind of grown big.
You know I did not mean that way. But we're so glad to have you and have your family here. This young lady to my right here looking so lovely. Tell us a little bit about yourself.
I'm Galena, her daughter. I am a senior at Blakely County, and I take classes at Middle Georgia also, and I'm hoping to go to Georgia College in the fall.
You know that's my alma mater. Yes. Tell us about some of the things you're involved in at Blakely.
I cheer, and I used to run. I don't run anymore.
Who does?
Yeah, not me. 4 years was enough of that.
Yes.
And so that's mainly what I do. And college classes preoccupy a lot.
Fantastic, fantastic. So what do you plan on majoring in?
Right now I'm kind of between marketing, business, and political science. I want to be a lawyer.
Very nice.
I haven't decided kind of what path I want to take before law school, but definitely law school.
That's fantastic. And you know, for a little while there, we college students would be a little bit called undecided. Remember those days? That doesn't give you free reign to just hang out.
I hope not to be undecided too long.
Yes, yes. And you'll find out exactly what your passion is, and we wish you the best with that.
Thank you.
Wonderful. Well, we're so glad to have all of you here. We know that you're bringing great things to the community and the surrounding community, and we really want to welcome you.
Thank you so much. We will definitely do our best.
We know you will.
Thank you.
Thank you. We're here with a physician, Dr. Harry Littleburg. Glad to have you here in the neighborhood.
Thank you.
Now, tell us a little bit about yourself, and let's talk a little bit about your specialty.
Okay. I am a physiatrist. My specialty is physical medicine and rehabilitation. Mm-hmm. We do some neuromuscular and some musculoskeletal treatment, including injections and ordering therapy. Mm-hmm. I do some electrodiagnostic testing called electromyography. Mm-hmm. And we supervise patients in the inpatient rehab unit after they've had a stroke or a hip replacement or cardiac or pulmonary problem.
Mm-hmm. Now, where are you coming in from? Tell us about that.
I came to Dublin from Canton, Georgia, where I did a fellowship for a year.
Very good. Well, we're certainly pleased to have you here. So what drew you here to Dublin, Georgia?
Well, my job search ultimately did.
Mm-hmm.
I was looking for a job. I'm licensed in Arizona, where I grew up, and here in Georgia, where I did my fellowship. Mm-hmm. And so as I was looking for a job during fellowship, this job came up, and I wound up here.
And how do you like this area? It's pretty cool here.
I like the town, yeah. It's smaller than any other place I've lived.
Mm-hmm.
Macon and Savannah are both close enough that if I need a larger place, I can go to them.
Yes.
And it's kind of a laid-back country life.
It absolutely is. And we're quite sure it's a little different from where you came down from Arizona.
It is.
But you're transitioning nicely.
Yes.
Well, we're certainly pleased to have you here. I should have asked you a medical question about my knee. Now, if you're talking about, doing rehab for a hip replacement, what about for someone like me who potentially needs a knee replacement?
So, within the last couple of years, the transition has been for knee replacements to get outpatient rehab several days a week instead of going to an inpatient rehab unit.
Really? Now, and I know how important the rehab is after the replacement because I know several people that have had replacements and they've had different results depending on the rehab afterwards.
Yeah.
And I've had surgery 3 times on this one knee.
So.
It's about time, you think?
It may be.
You're so sympathetic. That's what I really appreciate about it.
Well, no problem.
Glad to have you here, Doc.
Thank you.
Welcome to the neighborhood.
Thank you.
And we are pleased to welcome 2 more outstanding physicians. We've got Dr. Nicola Rebel and Dr. Paul Matthew. Yes, welcome. We'll start with the ladies. Ladies first. Tell us a little bit about yourself and your specialty, your area of expertise.
Well, I went to Mercer and did my residency in family medicine and also my fellowship in geriatrics.
Fantastic.
Yes. And so I've been in the central Georgia area for a while, so I really love this area. And so, just because we're in this area, I love the people and the culture, so that's how I'm here.
And where are you from originally?
Ooh, that's a hard question. My dad's retired Army, so originally Korea, and then all over.
Very good. Yeah. Well, my kids are Army brats, and so when you ask that question, they kind of look at you like, let me think for a minute of where I have not been.
Right.
Very good. And so when you did your residency at Mercer,
right.
How long have you been here, working here?
At the hospital? About 2 months.
About 2 months.
Right.
How's that transition been for you?
It's been wonderful. Everyone, the people that I work with are really friendly. They're very helpful, so that definitely always makes that transition a lot easier.
And your area of expertise?
Is family medicine and geriatrics.
Very good. And we've got a lot of, the older generation that are here and just a great group of people here. And to have someone of your caliber, we're certainly pleased. And tell us about your family. Do you have family here with you?
Well, I live in Birmingham, so I commute every other week.
How cool
to
is
Dublin.
that?
I know. Yeah, so when you go back home, everyone like appreciates you, and you get the
That's
good
what
meals again.
You have to leave and come back before you're appreciated.
Exactly.
Because you know when you're around family all the time, they're like, oh, hey, girl. But when you go and come back, it's like Christmas.
Yes.
Well, Merry Christmas. We're pleased to have you here.
Well, thank you.
All right, Dr. Matthew, it's your
Yes,
turn.
ma'am.
The floor is yours.
The floor is mine. Well, my name is Dr. Paul Matthew. I'm originally from New York. I did my residency at the Medical Center of Central Georgia and also did my fellowship at the Medical Center of Central Georgia, both in family medicine and geriatric medicine.
Very good.
I currently live in Henry County, McDonough, and I work here in Dublin.
You know, that's a pretty good commute for you as well.
It is, but it works. It works. It's not too bad. I hope we don't have any state patrolmen watching.
This face, you see this face? Act as though you don't know it. So you're from upstate New York, or where were you from in New York?
Actually, New York City, Queens, New York.
You're from Queens, and you have come down here.
Yes, ma'am.
How has that transition been for you? Of course, you know you did your residency.
Yes, in Macon, and it was a pretty good transition.
A little different, though.
A little different, I got used to the grits and eggs.
And, do you know what grits really are? Did you finally? When did you find that?
I think I do.
And it's not a grit, by the way.
It's not a grit.
I have some northern
grits.
friends. Yes, grits.
Yeah, that's plural. Many grits. Grits.
And girls raised in the South.
I think I heard that last week. That's right. Girls.
Very
that's
good.
Right. That's right.
Now tell us about your family, doctor.
Well, I've been married for about 5 years now. I have a 3-year-old daughter, just turned 3. And my wife is a professor. And we live in Henry County.
And where is she a professor at?
She actually works in 2 different places. She actually works online.
Very good.
She works for University of Phoenix and also Kaplan University.
Very good. Well, we're certainly so pleased to have you 2 commuters here. If it's safe to say you're commuting, both of you.
Definitely.
Yes.
But we are definitely honored here in Dublin to have you all here, to have your expertise, your know-how here, and we just want to say welcome to the family.
Thank you.
Thank
Well,
you.
thank you.
Thank you both. This is like a family reunion.
Yeah.
It is. Thank you. Thank you all so much. Good talking to you both. Thank you.
All right.